Hello friends, welcome back to my channel Veda of IU. Today we are discuss about the female reproductive system which consists of external genitalia and internal genitalia. So let's get started. This is the external genitalia which includes mons pubis, labia majora, labia minora, clitoris and vestibule. External genitalia is also known as vulva and what it was also known as pudendum. Okay, in this picture we will show you the parts of external genitalia. This uppermost subcutaneous outer layer is called mons pubis. Later we will discuss shortly. This subcutaneous fat like structure two folds, these are labia majora. Okay, and this where hairs are present and mons pubis, in this area hair are also present, but in this area where the hairs are absent, labia minora literally enclosed by labia majora. Labia minora meet anteriorly and forms clitoris. Then vestibule is a just triangular shape in which openings are present like urethral opening, vaginal opening, bartholin duct opening. So these consist of vestibule. So this is mons pubis. Mons pubis, what is this? This is the thick pad of connective tissue. This is the thick pad of connective tissue which has thick pubic hairs. Pubic hairs which was started during puberty due to androgen hormone which was secreted at the adolescent age, or you can say after puberty. You can see this is as a sign of secondary sexual hormone which is regulated by androgen hormone. Okay, now second is labia majora. Labia majora, firstly we will know from where it is derived from genital swelling. You should know it is derived from genital swelling. Okay, and labia minora, what is derived from? These derive from genital folds. Okay, and what about clitoris? Clitoris derived from genital tubercle. Okay, this is genital tubercle. These are the derivation from where it may formed. So in this picture we will previously discuss where it is present in this image. These thick folds of skin, these thick fold of skin which are present literally either side. Now they are present in both side of the vestibule. They are uniting posteriorly and forms a structure which is known as posterior commissure. I will show you. This is labia majora. Okay, this is labia majora, and this is formed posteriorly to form posterior commissure. Okay, these are covered with squamous epithelium. Okay, these are covered by squamous epithelium, and what it contains: labia majora, sebaceous glands, sweat glands, hair follicles, and it is homologous with scrotum of female. Okay, now we will discuss about labia minora. This where the hairs are not present, these two folds. I hope you are seeing. These two folds of skin medially to labia majora, they are fused anteriorly to form erectile body which we'll discuss. This is called clitoris. Okay, and they are fusing posteriorly to form structure forget. This structure. Okay, where the labia minora and this is forget, or you can say forget continue to form posterior commissure which is posteriorly uniting of labia majora. Okay, this is homologous to ventral aspect of penis. Okay, labia minora is homologous to male structure which ventral aspect of penis. Now we will discuss clitoris. Clitoris, what is the diameter length of this? 2.5 centimeter, and it is derived from genital tubercle, which was previously discussed. It contains glands, body, and two crura. Okay, and glands covered by squamous epithelium. You should know which epithelium is present in which part. It is analog to penis. Okay, 2.5 centimeter. It is too short as compared to penis. Lymph supply is especially supplied from what? Rosenmuller. You should know which lymph node is this. This is important, Rosenmuller lymph node, or you can say gland of Cloquet. Okay. Now next is vestibule. Vestibule is a triangular space which is present between clitoris anteriorly. This is clitoris anteriorly and fourchette posteriorly. Continuation of labia minora. This is anterior, this is posterior, and it forms like a triangular space. Anteriorly clitoris and posteriorly fourchette. Okay. In this triangular space, what opening is present? First is urethral opening. This is urethral opening. Okay. This is vagina. There is special kind of glands which is open into vagina. This is called Bartholin glands duct, or you can say duct of Bartholin gland. There are is also present skinny glands which is present anteriorly, laterally, both side of vagina. Duct of skinny glands, urethral opening, vagina opening, duct of Bartholin gland, duct of skinny gland. These are four structures which was opening into vestibule. Okay. Now the what is the blood supply of external genitalia? Blood supply, internal pudendal artery, nerve innervation, pudendal nerve, which was S2 to S4, and the lymphatic supply is inguinal lymph node and clitoris, which was specially supplied by Rosenmuller lymph node. Okay, inguinal lymph node. There is some special point, Bartholin gland. Site, what is the site of Bartholin gland? It is superficial penile pouch. You should know superficial penile pouch lined by columnar epithelium. Okay, open end junction of anterior 2/3 and posterior 1/3 in groove between labia minora and hymen. In this side, okay, Bartholin glands are present in this side. There are some common problems which was present in Bartholin gland, like a Bartholin cyst, which was infected by E. coli organism. Its treatment is incision and drainage. And second one is Bartholin abscess. Its treatment is marsupilation. What about external genitalia? Now the second most important is internal genitalia, which was clinically importance in gynec and ops. So what is the parts included in internal genital organs? This is vagina, uterus, fallopian tube, and ovaries. This is uterus. Okay, this is ovary, this is fallopian tube, and vagina is this. The hollow structure is called vagina. So we will start from the vagina. What is vagina? Vagina is a fibromuscular tube-like structure connecting vulva to uterus. This is uterus. This is uterus. And external genitalia, which was previously discussed about the vulva, labia minora, labia majora, vagina. This vaginal opening is this, and this is uterus. So it is the connective structure which connect vulva to uterus. Okay, it is lined by spatial epithelium. It is lined by spatial epithelium, which is called stratified squamous epithelium. Okay, stratified squamous epithelium. And the lower one third part, this is vaginal two third part, and this is one third part. This upper two third part of vagina derived from Mullerian duct. Okay, and the lower one third part of vagina derived from urogenital swelling. And what is about uterus and cervix? These are also developed from Mullerian duct. Okay, now what is the wall of vagina? Before it, we will discuss about the pH. pH is 4.5, which is slightly acidic. Diameter is 2.5 centimeter, and it is 45 degree horizontally. Okay, now what is the wall of vagina? Anterior, this is anterior, and this is posterior. Okay, this is posterior. Anterior is slightly shorter as compared to posterior, which is 7 centimeter, and this is 9 centimeter. Okay, and two lateral walls. These are the four: anterior, posterior, and two lateral wall. What is the phonesis? Phonesis, what is this? In upper part of vagina, cervix is protruding. This is the cervix protruding to vagina. This part. Cervix is protruding into vagina, form pouch-like structure is called phonesis. There are two phonesis: anterior phonesis and posterior phonesis. Anterior phonesis, this is vagina, and this is cervix. Okay, this is cervix. This pouch is called anterior fornix, and this pouch is called posterior fornix. Okay, two fornix are there. This is shallow and this is deep, as you seen that. Now bacteria. Which bacteria is present in vagina? Dodelin bacilli, which is helpful in glycogen convert into lactic acid. That's why we have the acidic pH in vagina. Maximum acidic pH, which was present in pregnancy. When maximum acidic pH, when pregnancy is occur, and basic medium is occur when menstruation and menopause is occur. Okay, now this is the vagina part. What is the relation? As we discuss, what is the relation between vaginal wall? Anteriorly, this is urinary bladder. This is vagina. Anterior, this is posterior wall. Upper one third, lower two third. This is urinary bladder, and this is urethra. In posterior, upper one third, middle one third, lower one third. Upper one third, pouch of Douglas. Middle one third, ampulla of rectum. Okay, and lower one third, perineal body. These are structures are present. And in laterally, upper one third, middle one third, and lower one third. You should learn. Upper one third, ureter and uterine artery is present. Middle one third, levator ani is present. Lower one third, bulbocavernosus muscles, vestibular bulb, and Bartholin glands are present. Okay, now what is the epithelium is? present in vagina. In newborn baby, epithelium is present transitional epithelium. Okay. Now, what are the types of vaginal epithelium cells? There are three types. First one is parabasal cells. Second one is intermediate cells. Third one is superficial cells. Okay. Now parabasal cells is present, yeah, or you can say that it is maximum when there is no hormones. Okay, no hormones, or you can say that it is present in menopause stage because there is no progesterone, no estrogen. In intermediate cells, when progesterone hormone is maximum or in peak, or you can say luteal phase of menstrual cycle where the corpus luteum is dominating, which produce progesterone. So we can say in this phase intermediate cells are present. Third one is superficial cells where the estrogen hormone is on peak or in maximum quantity, which is present in proliferative phase, or you can say follicular phase of menstrual cycle, which is graphene follicle, which produce estrogen. So estrogen is maximum in first 14th day of menstrual cycle. In this phase superficial cells are present. Okay. Now what is the secretion? As we know, in vagina there is no glands, so from where it gets its secretions mainly derive from cervix. Okay, mainly derived from cervix. As you know, the Bartholin duct is open into the vagina, which produces the secretion and gets lubricated during the intimacy. And it medium is acidic due to lactic acid, which was discussed about um, Dodolin bacilli. Now, what is the blood supply of vagina? Cervicovaginal branch of uterine artery. Uterine artery. Second one is vaginal artery. Third one is middle rectal artery, and fourth one is internal pudendal artery. And veins, internal iliac veins and internal pudendal vein. Iliac and pudendal you should know. Nerve supply, sympathetic and parasympathetic nerves from plexus, pelvic plexus. Lower part is supplied by pudendal nerve. That's why it is very sensitive to touch. Lower part of vagina is sensitive. Okay. Now, before we discuss about the uterus, we should know what is the position of vagina, cervix, and uterus combinedly. This is vagina, this is cervix. What they form? They form 90% to the vagina to cervix. This is called anteversion. Okay. Vagina to cervix, it forms anteversion, and cervix to uterus plane. Cervix to uterus plane, it forms an angle to 120 to 130, and it is called anteflexion. So some students have the confusion that they all these three organs, all these three structures are aligned in a same direction. No, it's untrue, because vagina forms 90-degree to cervix, and cervix forms uterus 120-degree, as you know, anteflexion position. Okay. Now uterus is 8 centimeter in length. It is insensitive to handling and even to incision over its wall. What is this? This is the hollow pyriform muscular organ. What is the position? Position we will discuss. It is anteversion and anteflexion. Okay. Uterus usually inclines to the right. Dextrorotation, cervix is directed to the left. What is the measurement of uterus length? We should know it is 8 centimeter, which is divided into which part? Body. This is fundus. This is body. This is isthmus. This is cervix. Okay. Body is 3.5 centimeter. Isthmus is zero point 0.5 centimeter and cervix is 2.5 centimeter. It is wide at fundus, which is 5 centimeter. Its weight is 50 to 80 gram. And in pregnancy it is approx 1000 grams. Okay. Now what is the part of uterus we will discuss before? This is body, this is isthmus, and this is cervix. In body there is three layers: perineum, myometrium, and endometrium, which was shedding monthly in the form of menses. Okay. Now what is the epithelium? Columnar epithelium is present plus living ligature. Living ligature, what is this? Middle interlacing layer in between longitudinal and circular muscles. In between there is interlacing middle layer which prevent bleeding during placenta delivery. It is called living ligature. What is cornua? Cornua, it is the junction of fallopian tube. This is the fallopian tube and uterine cavity. This junction is called cornua. Okay. Like see, this is fallopian tube, this is uterine. This is the junction is called cornua. Now, what is isthmus? As you know, the structures attached to the cornua, fallopian tubes. This is fallopian tube, round ligament and ovarian ligaments are present. Isthmus, what is the site? Site above anatomical internal os and below histological internal os. What is the importance of isthmus? It forms lower uterine segment during pregnancy, about 70%. It play important role in pregnancy. And what is cervix? 2.5 centimeter long, we will discuss it. Okay. What is the pH? pH is 7.8. It is basically in nature. Only posterior surface has peritoneal coat. It contains fibrous connective tissue. This part is cervix. Okay. It extends from histological internal os. देखिए, see, this is histological os. This is internal os. In between isthmus, histological os from where it extends and ends at external os, which opens into vagina, and it is felt during the pregnancy. We will see how much it effacement is present during the term pregnancy. Now it is divided into two parts, which is called supravaginal part and vaginal part. As you see, this is vagina. Okay, this is cervix, which this part which is enter into vagina is called vaginal part, and above the vagina this part is supravaginal part. In nulliparous, shape of external os is conical with external os looking circular, and in parous, shape of external os is cylindrical. In parous, okay, is like bilateral slit. Uterine cavity is 3.5 centimeter. This is 3.5 centimeter. Triangular in shape, no cavity in fundus. fundus. In this area there is no cavity. Now what is the relation of uterus? Anteriorly above internal os there is utrovesical pouch. Below internal os, base of the bladder. Posteriorly anterior wall of pouch of Douglas. Laterally double fold of peritoneum of broad ligament and attached of macandrodate ligament. Okay, it is developed from Mullerian duct. We will discuss previously. It is insensitive to touch, heat, and also when it is grasped by instruments. What is changes of uterus with age? Before puberty, the ratio of body and cervix is 1:2. During puberty, it is converted to 2:1 as the hormones are active. Reproductive age in this 3:1, and in menopause it is equals as 1:1. So this is the uterus. In next video we will discuss about the fallopian tube and ovaries. Okay, if you like this video, please like and share this video. Thank you.